Sickle cell anemia is a genetic disease that affects hemoglobin, the oxygen transport molecule in the blood. The disease gets its name from the shape of the red blood cells under low oxygen conditions. Some red blood cells become sickle-shaped, and these elongated cells get stuck in small blood vessels so that parts of the body don't get the oxygen they need. Sickle cell anemia is caused by a single letter change in the DNA. This in turn alters one of the amino acids in the hemoglobin protein. Valine sits in a position where glutamic acid should be. The valine makes the hemoglobin molecules stick together when oxygen tension is low, forming long fibers that distort the shape of the red blood cells, and this brings on an attack.
Some of the effects of sickle cell disease include anemia, pain, infection, jaundice, acute chest syndrome, pneumonia, organ damage, stroke, psychosocial issues, social, emotional, academic. When the sticky sickle cells become lodged in blood vessels, a number of problems can occur depending on the location of the blockage. Clogging of the spleen can prevent it from fighting off germs in the body, leading to increased risk of infections. This is why a fever is a medical emergency for a child with sickle cell disease.
Pain as it relates to sickle cell disease is one of the most common complications that we see in patients who have sickle cell anemia or sickle cell disease. When you don't have oxygen, when you have a lack of oxygen to the tissues, it causes tissue damage and sometimes tissue death, what we call tissue necrosis, which sends off signals that cause pain. And there are times where there can be chronic areas that have had repeated damage, so repeated insults of lack of oxygen to a particular tissue, which can cause more permanent damage or scarring.
A stroke occurs when there is an interruption in the blood supply to the brain. When a stroke occurs, some brains are temporarily starved of oxygen, causing them to swell and stop working properly. This is why the effects of stroke are worse at the beginning. After a few days, when the swelling starts to go down, some cells recover, but others may not. Even then, other parts of the brain can be encouraged to take over. Ischemic stroke. This happens when a clot blocks an artery that carries blood to the brain. It may be caused by a blood clot which has formed in the main artery to the brain, a blockage caused by a blood clot, air bubble, or fatty lump forms in a blood vessel somewhere in the body and is carried in the bloodstream to the brain. A blockage in the tiny blood vessels in the brain. Hemorrhagic stroke. This happens when there is a rupture of a blood vessel in the brain. It may be caused by a blood vessel which bursts inside the brain, a blood vessel which bursts on the surface of the brain and bleeds into the area between the brain and the skull. It is important to understand that no two people are affected by stroke in the same way. Some people have only mild effects which improve in a short time. Others may suffer more serious and long-term effects. The effect of a stroke on a person depends on which part of the brain has been affected and how much damage has been caused. The brain has two sides, hemispheres. The messages, nerve signals, cross over at the base of the brain.
Your doctor may recommend you receive a blood transfusion to treat your medical condition or to save your life. Your blood carries oxygen and nutrients to all of your tissues and removes carbon dioxide and other waste products from them. Blood also helps fight infection and heal wounds. Blood consists of a liquid portion and cellular components. The liquid, called plasma, is where nutrients, hormones, clotting factors, and other chemicals are dissolved. The cellular components are suspended in the plasma. They consist of red blood cells, which transport oxygen and carbon dioxide, white blood cells, which fight infection, and platelets, which are small subcells that help the blood to clot. Blood cells are made in the bone marrow, a soft tissue housed inside many of your bones. A blood transfusion uses donor blood to replenish red blood cells, white blood cells, platelets, clotting factors, plasma, or whole blood. Circumstances that may require a blood transfusion include blood loss due to trauma, heart or other major surgery, organ transplants, bleeding disorders such as hemophilia, severe anemia including sickle cell anemia, treatment for leukemia or other types of cancer, disorders that destroy blood cells or bone marrow, or Rh incompatibility in newborn babies. To begin the transfusion, an intravenous needle will be inserted into a vein in your hand or arm. A bag containing the donor blood will be hung nearby, and the blood will drip slowly through a tube attached to the IV needle, allowing it to run through your vein into your bloodstream. Throughout the transfusion, your temperature, heart rate, breathing, and blood pressure will be monitored. After the bag is empty, if you require more blood, another bag will be attached to the IV tube. When your transfusion is completed, the needle will be removed. After your transfusion, your doctor will monitor your vital signs to make sure you are not having an adverse reaction. If necessary, you may be given a diuretic to reduce any swelling or fluid retention.